We have already gone through our last two lectures where you have now known very well about the anatomy and the physiology of bacteria, right? Now we'll go a little bit ahead, like how do you identify the causative organisms? How do you identify that which particular bacteria it is, and how do you help your patients by prescribing one antibiotic? Okay, that is the whole lecture today. So, laboratory diagnosis of bacterial infections. The assessment for this will be done as you will get written assessment where you may be asked long questions, short notes, okay, and also viva voces, and many MCQs also can come from here. So first of all, let us see what is infection. It is a process in which a pathogenic organism enters into the body, establishes itself, multiplies, and invades the normal anatomical barrier of host, resulting in disease. All of you know about what is infection, right? So now, when infection becomes apparent, results in clinical manifestation, and it is referred to as infectious disease. So, basically, the bacteria, virus, whatever it is, like any microorganism, it has to enter in the body and it has to make some manifestations. When the patient comes to you, he will come with symptoms. Patient will come with some symptoms, and you have to know that these particular symptoms are going towards which particular infection, and also you have to elicit certain signs on the patient, and you have to write some lab diagnosis to know what is the causative organism, what is the cause of this infection. Once you get the lab diagnostic, all those reports, then you may also get, if you are sending a culture, you may get the sensitivity report where you get to know which antibiotic to be given. And then you prescribe your patient becomes well. So that is the whole story that you are going to do throughout the rest of your life, right? So you need to know what is the causative organism. Few causative agents of bacterial infections like cellulitis, abscess, even boils, Staphylococcus aureus, causative organism. Streptococcus pneumoniae causes meningitis or pneumonia. Escherichia coli causes UTI. There are many more in the list. Even thousands of bacteria are there. Some bacteria are good for us, as I was telling you. Okay, they are called as normal commensal flora. That is in our body we have, but these are the pathogenic ones which causes infection and diseases. Importance of laboratory diagnosis. Why do you want it? To identify the causative bacterial agent responsible for the disease, to provide accurate antimicrobial therapy for outbreak investigation. For example, diphtheria outbreaks in the community or methicillin-resistant Staphylococcus aureus outbreaks in the hospital. So I told you about the causative agents for your infections for the patients. Even we need this for microbiological investigations, we need for our outbreak investigation. Suppose there is one epidemic in one place. Remember about COVID we had, that was also an outbreak, there was a pandemic, right, all over the world. So those outbreak investigations also, we need this etiological agents need to know. To start, PEP or post-exposure prophylaxis useful in infectious diseases such as anthrax and plague. To initiate appropriate infection control measures in the hospital, we need some infection control measures so that one patient doesn't infect another patient or there is no outbreak. There are certain bacteria like we say methicillin resistant Staphylococcus aureus or MRSA, which is very vulnerable bacteria. So, and also MDROs, that are the multi-drug resistant organisms, where they are resistant to almost all the antibiotics. Okay, so this plus droplet precautions for diphtheria and airborne precautions for tuberculosis. Tuberculosis patient, if he is having active tuberculosis, pulmonary tuberculosis, and if you are sitting next to that patient, you may get tuberculosis. Okay, because from the aerosols, he may be the droplets, the bacilli may be transmitted. Bacterial infection laboratory diagnosis. What are the steps for it? First is specimen collection. You have to collect the sample. Then specimen transport, direct detection, culture and identification. So these are the different steps of laboratory diagnosis. First you have to collect the sample. Then you have to transport the sample. Then you have to do direct detection of the sample or the culture of the sample. Then antibiotic sensitivity you have to find it out, and then you have to do the identification is by or different biochemical tests, which we will see today. How to identify this particular bacteria. So morphology by staining, we are already seeing some morphology by staining, right? So first of all, we do the morphology by staining. Then culture characteristics, we see when you grow it in the culture plate, what is the characteristics we'll see. Biochemical test, we have many biochemical tests for it to perform. So identify to come to a pinpoint that this is an E. coli or this is an Klebsiella. Okay. And then confirmation by immunological methods. Certain immunological methods are there which also we use. Testing for pathogenicity. We may use some animal models in this, but this is usually in a research activity, not in the diagnostic field. Then molecular detection and confirmation, recent advances. You may be asked about this question also. So each and every point is very important for your exam purpose. Okay? Because examiners expect you know these basics. So nowadays we have got advanced technology, molecular techniques also, and we have conventional techniques also for identification. Specimen collection depends upon the, so let us see the specimen collection. Specimen collection depends upon the type of the underlying infection. Means what? If a person is having urinary tract infection, you will take what sample? What? Urine sample. If he is having respiratory tract infection, you will take sputum sample. Okay? Or maybe if he is having an upper respiratory tract infection, you will take a throat swab. If he is having a boil, you will take the pus. Okay, if he is having bed sore, you will take pus. If he is having meningitis, you will take CSF, cerebrospinal fluid. So it depends on what your patient is having. So you have to decide that particular sample to be taken. And then there is some standard precautions. We need certain standard precautions. You know the standard precautions? Do you know standard precautions? What is? Tell me one, two. Clean your hand, wash your hands. Okay. Then you have got PPE, we say, no? PPE, personal protective equipment. So all those you need. There is a whole list of, there is another class on this, we'll take later. But basically you have to protect yourself. You have to work in a sterile environment so that the patient doesn't get, you don't get infected from the patient or cause any cross infection. Culture specimen to be collected prior to antibiotics. Very important. Okay. So the patient comes in an emergency. You find that he is having sepsis. You understand sepsis? Bacteria in the blood, in a whole blood. Okay. So there is like patient may die very soon if you are not treating him. So you have to give him some antibiotics. You understand that okay, his TC count is high, he is having fever, he is having all the symptoms of sepsis. I have to treat him with some antibiotics. So you have an empirical treatment for him. And now when you are treating him for antibiotics, you have to take the sample before giving the antibiotics. Remember this. Because we want the bacteria to be there. Because once you start the antibiotics, you may not get the bacteria. So we don't know what is the causative agent, what is causing the disease. So this is important. Avoid contamination, especially urine and blood cultures. So We have got our normal flora, I told you. We have skin flora. So when you're taking blood culture, you have to take in such a way, you have to make that area sterile first so that you don't take the bacteria from the skin. You need the bacteria from the blood. Is it okay? So that is what they're talking. Or urine sample. For urine sample, you have to take clean catch midstream urine. Okay. First ask the patient to clean his area and then you have to take a midstream. Little bit of urine to be passed and then the midstream urine. Or else you'll get the contamination from his normal, flora lying there. And you'll grow that in the lab. So, and you don't give the proper antibiotic. That's what. Swabs also, when you're taking swabs, you have to be very careful to take it from the inside part of the wound, not from the exterior part of the wound. Container needs to be sterile, leak-proof, wide mouth, screw capped. Sterile container, leak-proof, it should not leak, and wide mouth, screw capped. Labeling and requisition, all these will be again taken in SGT, very important. In the labeling part, if you do not label properly, if you are having 4 or 5 patients, you are labeling it, wrongly. So what will happen? You will not get the proper, you will be basically missing that. And that is a blunder which happens. Okay. So all the information has to be there, patient name, his ID. Every patient has got some unique ID in a hospital. So that has to be there because there may be 2 patients with the same name. So you need that unique ID also. And what investigation are doing, what antibiotic he is on. So all those you have to write in that requisition form. Then is a rejection criteria. In microbiology, we have got rejection criteria because if the sample is not proper, okay, if sample is inadequate or there is some spillage on the sample, so then we have to reject it. We have to ask for another sample. Anaerobic culture needs proper collection and specific media. So anaerobic environment is required, as you saw yesterday. We are talking about the anaerobic cultures. So there you need special media for it. We'll see what are the medias. Specimen in formalin not accepted for culture in microbiology. So in pathology, when they are sending, you'll be learning pathology also. They will be sending certain samples, okay, biopsy samples. They use formalin for preserving. But for our microbiology, any sample that is, whoever is not attending this class, I don't know, they will be missing all these points. These are asked in your exams. Okay. So, if a sample comes to a lab, in formalin, in microbiology, we just reject it. You can't use that sample because your bacteria is already killed there in the formalin. So that is one important question they will ask. Transport media, there are certain transport medias which we use. ASAP and not more than 2 hours to the lab. So what is this? As soon as possible, you have to send the sample. If a sample comes to you, you're collecting the sample maybe in the hospital ward, emergency, or in the OPD patient, and then a lab is at a distance. It should be as soon as possible for microbiology samples because more delay happens, then it's not okay for the bacteria's viability. So, or within 2 hours they are given time. Storage before processing, there is again different samples needs to be stored in different, suppose you are sitting in a remote place, your lab is a little far away. So then how to store it? That is also a process, methods for different samples. Blood culture bottles to be incubated at 37 degrees centigrade, very important. After collecting the blood culture bottles, you will be seeing some blood culture bottles in your lab, in your practicals, I will show you. So these bottles needs to be kept at 37 degrees Celsius, not in the fridge. Means what? Before processing it. Okay, we want this in the blood culture bottle, we have some media which helps the bacteria to multiply. So we want that. So this is also important, 37 degrees Celsius. Stool and urine to be stored at 4 degrees Celsius. But stool and urine, we want to keep it in the refrigerator. We have a simple household refrigerator, 4 degree, 4 to 8. So there you have to keep it. Direct detection of bacteria in the clinical specimen plays a very important role in early institution of antimicrobial therapy. So sometimes we do a direct detection by doing gram stain, or it may be an AFB stain, differential stains before culturing also. We need to do, as I was telling about the motility and Vibrio cholerae, that is a direct detection, hanging drop preparation. Then staining techniques. Structured details of the bacteria cannot be seen under a light microscope due to lack of contrast, so we need to stain them. It is necessary to use staining methods to produce color contrast and thereby increase the visibility. So this stains, simple stain, negative stain, impregnation method, this has already been taken in your class. So I will just skip this part. Differential stain is, again we have got three stains here: gram stain, acid-var stain and Albert stain. All these stains are important. You have to perform yourself. You have to show to the examiner before you can pass microbiology. Okay. So these are all important. Acid-fast stain is for differentiates bacteria into acid-fast and non-acid-fast. Microbiome tuberculosis, microbiome leprae, which you have already known by now. Gram stain, it will be differentiating gram positive and gram negative. What is the reason for gram stain, gram positive, negative? That also you have seen yesterday. And then Albert stain. This is for Corynebacterium diphtheria. Identification by the metachromatic granules. You have to identify the granules and this arrangement, typically the Chinese letter pattern arrangement of the bacilli. Other microscopic techniques: dark ground and fast contrast microscopy for demonstration of spirochetes in the genital specimen. Hanging dot preparation for stool specimen, that I was talking about, the Vibrio cholerae. Okay. Now, antigen detection. Various immunological methods such as latex agglutination test and immunochromatographic tests are available, which detects antigens in clinical specimen. So we even go for antigen detection of this bacteria. Usually it is done after culturing and getting the colonies. So you want to see the antigen detection, you have to use an antibody, and then you see the agglutination test, serological test. Direct fluorescent antibody test for detection of Treponema pallidum. What is Treponema pallidum? Can anyone say what it causes? Huh? Syphilis. Okay. From tissue secretions or exudates. Culture is the most common diagnostic method used for detection of bacterial infection. Okay. Specimens are inoculated onto various culture media and incubated. The colonies grown are subjected to identification and antimicrobial susceptibility testing. So what do? Take the sample. Okay. Receive the sample, transport, temperature, everything is there, and then you think that okay, this sample is okay, let me process it. So when you are processing the sample, you have to put it in a culture plate. Okay, you saw those plates. Huh? So you take the culture plate, you will see more next week. So culture plates, in that culture plate you grow the colonies, keep the favorable temperature and all. And then from there you take little bit of colony and you process it for identification. Do the staining. Gram stain, whether it is gram positive or negative, you see. Then we have an array of biochemical tests, which are for gram positives and for gram negatives, separates. And then you find out which particular pinpoint that this is the organism. Once you find out the organism, you do the antibiotic sensitivity test. And you know which particular antibiotic is sensitive, resistant, whatever, and you prescribe to the patient. Okay? So we are just like the whole story I just narrated in this one, but we'll see it now. So culture and identification of bacteria, culture media, how do we grow bacterial growth on media, staining of bacteria, identification based on biochemical test, in vivo pathogenicity test and immunological test. Reasons to cultivate microorganisms in pure form, to demonstrate characteristic properties, virulence and genetic properties, to determine antibiotic sensitivity, prepare antigens and vaccines, immunological and research purposes. Essential ingredients of culture media: water. What are the ingredients of these culture medias? Water, electrolytes, agar, cell wall of seaweed. So agar is a very important constituent of all the medias. Okay, what it causes, it makes the media a little bit of semi-solid. Otherwise, all these will be in liquid form, right? We want to give it a shape, sort of semi-solid. So agar to solidify. Then you have peptones, proteases, polypeptides, and amino acids. Inorganic salts are phosphates, potassium, and magnesium. Accessory growth factors are riboflavin, blood, serum, and yeast extract. So it depends on which media it is. You don't have everything in one media. Some media may have blood, some media may have something extra. Sometimes antibiotics are also used in the medias. So different things are used for different medias. Now, grouping of the culture medias by consistency of the media. Liquid media, solid media, and semi-solid media. So we have liquid, solid, and semi-solid. Liquid is usually diffuse growth of bacteria, you see in the whole thing. Usually it is used also to get, when you're having the colony, you want to put it in a lawn culture, then you also want a liquid media. For 2 hours, you have to incubate and you get a liquid media and peptone water. Then blood culture medias are also liquid media. You'll see them, blood culture medias. Solid medias, bacteria show distinct colony morphology in this. Characteristic features like pigmentation you can see, hemolysis you can see. Agar, now agar is base of the solid media. What is it? Melts at 98 degrees Celsius and solidifies at 42 degrees Celsius. Concentration of agar is 2%. These are all important things for you, which I have put here. Okay? And semi-solid agar is lopi agar. Concentration of agar is 0.5 to 1%, where it is little bit less, used to demonstrate motility and stock cultures. Stock culture is basically used for keeping the bacteria for longer time in the lab. If you want to preserve it for longer time, for 1 month, 2 months, 3 months, then we use this stock culture or the semi-solid agar, where the agar concentration is little less. Then based on, again on simple basal media, nutrient broth and nutrient agar, complex media, ingredients added to bring out certain characteristics to provide special nutrients to the bacterium. Synthetic media, these are from pure chemical substances, minimum essential medium. Then this grouping is made on functional requirements, very important grouping, where you have enriched media. They'll ask you what is enriched media and enrichment media. There are two different things. Okay. Enriched media, the word enriched means what? Richer. Something rich, right? Enrich. Enrich, you are making it richer. How you are making it richer? Because you want to grow some fastidious organisms, which are, these organisms require some extra nutrition for this growth. They are like, I don't want to grow in a very simple medium. I want to grow in a very rich medium. Okay. So what are these mediums? They use usually blood. In this we have blood agar, blood, serum, egg, etc. So one example is the blood agar. We use sheep blood agar added to basal mediums. You know the sheep, you know, right? We use for streptococcal bacteria to see the hemolysis and to identify. We need this sheep blood agar. So we used to basically keep a sheep for it and then take it from his blood from his jugular vein and then put in the media. Okay, to allow the bacteria. This particular bacteria is streptococci. They beta hemolytic streptococci to show the beta hemolysis. It's better to grow in sheep blood agar. Okay, nowadays you can commercially also get this sheep blood agar. So beta hemolysis, that is complete lysis of RBCs and hemoglobin. Alpha hemolysis. So hemolysis also you should know about beta, alpha. Alpha is partial lysis, where it will be only greenish color, but is no complete hemolysis is not there. So this is beta hemolysis, Streptococcus pyogenes colonies. You see, there's a complete. These RBCs are here. When you are growing, this is in the media, in the agar media, agar plate, which we have used blood, okay, to enrich it. And now what happens? These colonies, when they are growing, what they will do, Streptococcus pyogenes, they will make a halo around it, clearing around this, because they cause lysis of the RBCs, okay, and it is complete lysis. So it is complete clearing, and we call it this particular hemolysis beta hemolysis. Is it clear? And now we have this here. This is also another form of Streptococci, another type, another species. This is Streptococci pneumoniae. It causes alpha hemolysis, where it is only not very clear, partial hemolysis. Okay. So by seeing these two things, seeing it under the microscope, we can say this is particular bacteria. This is how we identify the bacteria. Now we have another chocolate agar. So when that blood agar, the same thing when you're using the blood in the media and then you allow it to heat for some more time. So what will happen? The RBCs will be breaking down around 55 degree or 60 degrees if you want to heat it. So then this chocolate agar is made. This is how they prepare the chocolate agar. So heating mixture of blood agar, sheep blood and nutrient agar. So factor X and factor 5 are released. So we want this. There are certain bacteria, Neisseria gonorrhoeae, Neisseria meningitidis, which grows in this fastidious growth organisms grows in this environment. They need this factor X and factor 5 outside. Okay, so that's how we have come up with this chocolate agar, and then we allow this to grow. So what are these organisms which grows in this? You should know this. Okay. And then brain heart infusion broth is highly nutritious for again fastidious organism. This is a broth. This is a liquid media. Now I was talking about the enrichment media. So we have seen the enriched media. Now it is the enrichment media. Okay. Enrichment media. Okay. Enrichment media is a media where you use certain inhibitory substances. So in this media, we want to grow specific bacteria. We don't want everything to grow. Okay. So that is the whole difference. So it's like has inhibitory agents which selectively allows some organisms to grow. Okay. And used for samples like stool and sputum. Suppress commensals, allows pathogens to grow. Tetrathionate broth, Salmonella typhi and Selenite F broth for Shigella. So I put some examples here. Salmonella typhi, which causes typhoid, and Selenite F broth for Shigella. So this tetrathionate broth is an enrichment media for Salmonella typhi. For Selenite F broth is for Shigella. Alkaline peptone water is for Vibrio cholerae, about 8 pH. You saw that pH, usually it is 7.2 for all the bacteria they need, right? But here they need, for the Vibrio cholerae, they grow better in a little bit of alkaline pH. Okay, so this is an enrichment media. Selective media, solid media with some inhibitory substance agents which selectively allows some organisms to grow. So what is the difference between this enrichment media and selective media? Can you tell me? Usually this is a solid media, the selective media. Okay. So this also contains inhibitory substances. For example, DCA, XLD agar for Salmonella and Shigella, TCBS for Vibrio species. You have to know all these medias, name of the medias. They'll ask you. This is very favorite questions in all vivas. For your theory, everything. This chapter is very, very important. You have to know every bit of it if you want to pass. Okay? LJ media is for mycobacterium species. So these are the selective medias. So you can see here TCBS agar. Okay. This for yellow colonies you can see for Vibrio cholerae, and these are Vibrio parahemolyticus producing green colonies. Okay. And this is LJ media used for Mycobacterium tuberculosis. Okay. We do the culture in this. Remember? It takes a lot of time, around many days for it to grow here. Incubation period is long. Now this is another culture medium, potassium terulite agar. This is for showing blackening of C. diphtheria. C. diphtheria, Corynebacterium diphtheria. We have Wilson and Blair for Salmonella typhi. We also have Salmonella Shigella agar for Salmonella and Shigella to grow. Potassium telluride for C. diphtheria. Okay, they have some indicators that change the color. Okay, so indicators are there in this particular media, so it changes the color. So when you are growing, C. diphtheria, you are taking a throat swab and you are trying to find out whether it's having C. diphtheria in the sample or not. So the many organisms are there in our throat. Okay, So if a patient is having C. diphtheria, he will grow only this, and you see that this growing this black color colonies, you are very sure this is Corynebacterium diphtheria. Okay, and this is again a notifiable disease. So notifiable disease diphtheria, because it may again spread, it causes usually endemic, and then you have to isolate that patient, treat that patient. So there is a lot of work. Now these are the plates very often every day we see in our labs. These two plates, they're very common. Okay, there is one is of E. coli, another is of Klebsiella pneumoniae. E. coli, Escherichia coli. You see these pink color colonies. Okay, these are lactose fermenters. Okay, and for usually the enteric pathogens. So we have got enteric pathogens. If you take a stool sample, if I take any one of a stool sample, any patient will get these colonies for sure. Okay, because E. coli is a normal commensal flora of our GIT. Okay, but it may become pathogenic in patients. In a small neonate, he is having diarrhea. There are certain strains of E. coli which can be pathogenic. Understand? So there is the importance of knowing how to identify the strain also of the bacteria. And then we have Klebsiella here, Klebsiella pneumoniae, mycoid colonies. See, it's like jelly sort of mycoid colonies of Klebsiella pneumoniae. These are lactose fermenter or pink colonies. Now, McConkey's agar with flat, smooth, colorless colonies of Salmonella. See, these are pale colonies. Can you see? This is a non-lactose fermenter. Okay, so these are pale colonies of the Salmonella. And this is again another selective media for clad agar, which is for pink colonies for E. coli. Then we have the transport medias. So what are the transport medias? If you know, that is for transporting. These are for transporting fastidious organisms. For gonococci, this gonococci bacteria is very difficult to grow. I have grown in my PG days. It's very difficult to grow. It's very fastidious. It dies very fast. So today you see the bacteria, tomorrow it's gone. There is autolysis. It kills itself. Okay. So they need some special medias. Fastidious means they are very delicate. They need Stewart's medium. Then we have for enteric bacilli, we have Claribel transport medium. Then we have again for enteric bacilli, like for stool samples, you can take buffered glycerol saline. Then VR medium is used for Vibrio cholerae. This is also asked in your exam. Venkataraman Ramakrishnan medium, VR medium for Vibrio cholerae. Okay, the stool has to be sent in VR medium, so it will stay there sometime. It is a little bit alkaline pH because this bacteria likes alkaline pH. Anaerobic medium has reducing agents. This anaerobic medium also, we cannot, if you want to get from a pus sample, you are thinking this pus may be having some anaerobes. You cannot just send it like that because, just swab liya, bhej diya. If you are sending it for E. coli, it is fine, but you cannot send it for anaerobes. You need a particular transport media for the anaerobes so that the anaerobic condition is maintained when you are transporting also. So you have here reducing substance agents. This is Robertson's cooked meat medium and thioglycolate medium. These are the two mediums which are used for anaerobic conditions. So here we have list of, you will have this in your book, list of mediums, list of specimens and organisms which are preferred. I'll give an example. If it is blood agar, all aspirates specimen for blood agar, what do you use? All aspirates, body fluids, blood exudates, urine, will use the blood agar. Okay. So all common pathogenic bacteria, Haemophilus and nutritional deficient bacteria will grow in the blood agar. Suppose you have, you are thinking this patient may have Haemophilus influenzae infection, or it may have Streptococcus pneumoniae. You saw this hemolysis, right? Streptococcus pneumoniae infection or Streptococcus pyogen infection. He is having a strep throat. Then you want to take a swab and you want to plate it in what media? Yes, you have got so many medias. We have seen, right? So you have to know which media it will grow the best, which media you will use for differentiating it, to identify it. You have to use the blood agar. If you are taking a sample secretion of urethral secretion from a gonorrhea patient, so which media you will use? We will use the chocolate agar. Okay. So we have to decide. If you are taking urine, which media you will use? You can answer now. Urine. Who is the smartest kid in this class? If you are taking urine sample, I want to go for one media. One media. I told you, you have to think like that. See, microbiology is not just by hearting. You have to understand and you have to recollect, correlate. So is what media? Urine. Makes most commonly is which organism? I told you. Which organism? Urine. Urinary tract infection is caused by which organism? Escherichia coli. So few minutes back you saw that agar plate. What was that? I showed you the colonies of Escherichia coli. The pink color colonies. Remember? These colonies of Escherichia coli. What is this? This is McConkey's agar. Got it? So it's not by hearting. You have to correlate things. Because in your exam, they will be asking questions like that. It will not be straightforward, at least, that I am talking now. So you have to understand, like gonorrhea, I told you one, I gave you one or two examples. Like, if you want to culture blood, which agar? If you want to culture, what do you say? Yes, blood sample that is already come positive in your blood culture bottle. Now, which agar you use? You have to use blood agar, you have to know, you have to use McConkey's agar to see if there is Escherichia coli also can happen, or even Klebsiella can infect blood, septicemia patients. Okay? Then you have to use even blood agar for it. Why? You want to see whether there is Enterococcus or Streptococcus infection or not, Streptococcus pyogen infection in the blood or not. So that is how we think in the lab, that what to use for which sample, for which bacteria. Okay? So now, this is like how we do the culture plates, how it is, like in our lab if you go, we usually do the culture in this method. Okay, the whole idea is, this is what you have taken a sample. Suppose a sputum sample you have taken. From that sample, you have decided that I will plate in a McConkey's agar. So what you do is, you have to start from one side. You have to make we call it a well, WELL, well. So you make it a well, rub the sample here, and then you make with the inoculating loop. These are the inoculating loops. See, you will see this in the lab. Then we make straight lines like this. Slowly we make again straight lines, and here and here you can get identifiable. These are the pure growths which are separated. The bacteria we want to separate it. Why you want to separate? We don't know. We may be getting here 2 bacteria also. That may be one more than 2 bacteria in your sample. So you want to get a separated, pure, isolated bacterial colonies. Okay? Separated, pure, isolated bacterial colonies in your plate for further processing. You have to do something with those, right? You just can't see and show, okay, this is done my work. No. From here, we want to pick up colonies. What will you do? Tell me now, what will you do? First step. After picking up one colony, you will identify, obviously, you will identify the color, shape, size, everything. Then what will you do? You will do staining. You will do staining, you will see whether it is gram positive or gram negative. Remember, I was talking? If it is gram positive, we will have some biochemical test for it. If it is gram negative, we will have some biochemical test for it. See how you separate how you do it. So this is all how do the streaking method. We have other methods also. This is called the streak culture method, streaking. We call it streaking. Inoculation, streaking, these words you have to know. Then next is lawn or carpet culture. We also have a lawn culture. When we do for the antibiotic sensitivity, you just rub it like a lawn, this way first and then like this, the swab. Then we have stroke cultures. Stroke cultures are usually used for in the biochemical test and also for other stock cultures. Liquid culture method also you can do it. So then after getting that, after you are basically inoculating, you have to put in this incubator, the sample, you put in the incubator and the plate that has come out is from this incubator. 24 to 48 hours, usually at 37 degrees Celsius, a place in colony formation, or if you're putting in a tube, it will be a turbidity. Okay? Next is anaerobic culture methods. Now here some culture methods that we have been shown for anaerobic. This was aerobic. Okay. If you are doing for anaerobic bacteria, we have certain different culture, incubation places where to incubate them. So we have got this Macintosh filled this anaerobic jar. This is no more used in the now. It may be asked in your viva. It was used in the past. Now we have this. Gas pack jars. So this is basically method of choice, simple and effective. Disposable envelopes. We get these envelopes to buy from the market with chemicals that generate hydrogen and carbon dioxide. So carbon dioxide environment is there. You see the plates are kept here. These are the culture media plates. So we have to close the lid properly. And there is a catalyst inside and then it produces anaerobiosis. That is carbon dioxide and hydrogen is produced there. Oxygen is all utilized. So this is the new one what we use. There are other methods also. There is automated microprocessor. Control system or automatically evacuates the air and replaces with hydrogen gas from a cylinder for anaerobic, microaerophilic and caprophilic bacteria. And because this in lab, we also have this glove box or anaerobic chamber. So where only the lab technician or the microbiologist, he can only enter his hands inside. Okay, the whole thing is packed. So, and there is an anaerobic condition inside which doesn't allow the oxygen to be there. So, you can grow the anaerobes. So, this is pre-reduced anaerobic system and culture methods. This is also asked in your exam. These are the culture medias. What is this? RCM is Robertson's cooked meat medium. This is a RCM bottle. These are the meat pieces, okay, which allows the environment for anaerobiosis, and also thioglycolate broth. This is a liquid medium where used for like uniform turbidity, you can see here, and it's like surface growth here in the surface and some granular turbidities. So these are the medias which are used for anaerobiosis. So now next we come to preservation of microorganisms. How to preserve the bacteria? For preserving the bacteria, we even get like from Delhi, if you are doing aqueous samples, like external quality assurance, every lab has to go for external quality. Whatever I am giving a report, it may not be right also, right? So there are certain labs in India or worldwide, they have some control. So a lab, how good it is performing, that is based on the external quality assurance program. If you are participating in external quality assurance program, what you will do, they will do is from that particular center, CMC Vellore has, Fir Gangaram, Delhi has. So what they do is they will send you lyophilized bacteria. Lyophilized bacteria, you have to again from that lyophil, these are like powdered forms you will get in ampoules. Those bacteria you have to again grow in your lab, and then you have to do all those processes, identify them, and then send them. And they will give like an exam, and then they will tell you, okay, this you are getting this much marks. You have right. You are correct for this bacteria. You are wrong for this bacteria. You get it? This is a program. Okay. So here for that we need this preservation of microorganisms. Lyophilization is rapid freezing and thawing using a lyophilizer. There is a particular instrument for it. Then we have freezing, frozen at -80. We have one -80 in our lab. You'll see. So even you can freeze them, keep it for longer duration, and then or preserved in liquid nitrogen. Subculturing on solid liquid media, preservation of short duration. So another, this is used almost in all the labs. These are used in specific research labs. So, what you can do is, suppose you have got a growth in a bacteria in a media, so you want to keep it for longer duration, you can just take a little bit of the colony and put it in another media, fresh media. No? So this is subculture. We call it subculture. Pick it up and again you can pass to another media. Because that media, original media, the nutrition is exhausted, right? After a particular time. So you want to keep it alive. So that is also one way. Now, how to identify the bacteria? I was talking to you about those. You saw those E. coli colonies and Klebsiella colonies. So you can even, just by seeing with experience, you can know this is a particular growth. You know, microbiologists can say this is the growth. So these are the characteristics. Shape of the colonies, whether it is circular, rhizode, size in millimeters, whether it is big, small, mucoid, or it is hard. So all those characteristics. Elevations, and then we have concave, margins, surface, smoothie or waxy, edges, entire, and then color. Color is very important. Golden yellow, white, buff colored. From this we can even know. Even they have got some bacteria like Pseudomonas, Proteus. You can even say that from the smell of the bacteria also you can say this is the bacteria. Okay, the order. And then emulsifiability and consistency. In liquid media is quantum of growth or turbidity. In liquid media, we will see how much growth it is there, presence of deposit and its characteristics and nature of the surface growth. So whether it is growing on the surface, whether it is growing on the bottom, that also you can say. Identification of bacteria by the biochemical test. This is another very important. What I was talking about is biochemical test. So what all biochemical tests you can do? There are many. Catalase and oxidase test is done almost in many culture growths. So catalase test is usually done for the gram-positive bacteria. So you have done a staining of the gram staining and you have seen these are gram-positive. Now, first test you will do is catalase test to differentiate between Staphylococcus and Streptococcus. Okay. So if it is Staphylococcus, it is catalase positive, Streptococcus is catalase negative. Then to come to Staphylococcus, whether it is pathogenic, you will do a coagulase test. So if it is producing coagulase, means it is Staphylococcus aureus. If it is not producing any coagulase, then it will be like Saprophyticus or epidermidis. So now you come to, these are the conventional methods. That's how we do it. Catalase production is prompt effervescence with H2O2 for Staphylococcus. We get it. Oxidase reduction, this is done for the gram-negative bacteria. This particular, there's a reagent which is about 1 to 1.5% tetramethyl p-phenyl N-diamine hydrochloride. You have to remember this. They asked in a Viva. Okay. So what we do is, I will show you in our lab. Okay. So if you have Pseudomonas aeruginosa, this is a Pseudomonas bacteria is a gram-negative bacteria. Okay. So or Vibrio cholerae, these are oxidase positive. So if you are getting a gram-negative bacteria, now you want to see by doing the oxidase test. If these are positive, okay, these are the two organisms positive, probabilities. Then you have to do the motility test. From that, if you get a dirting motility, so you can know this is Vibrio cholerae. So like that we come to this. Colonies turn purple in 30 seconds to minutes. Pseudomonas and Vibrio cholerae. This is, you take, there's a method which we'll show in your lab for this. Next is for gram-positive. This is a whole list of tests which you do for the gram-positives. From gram-positives, coagulase test, what I was telling you. Then CAMP test, catalase test, bile esculin hydrolysis, inulin fermentation, bile solubility, antimicrobial susceptibility for bacterial identification, optogens, and the bacitracin susceptibility test. For common biochemical tests for gram-negative bacteria, we do indole test. We'll try to show you all, though we do not have all the bacteria, but I'll try to arrange for your indole, citrate, urease, oxidase, triple sugar, some of them. Okay. So these are the tests. These are asked in your exams, all of them. How to identify which bacteria is positive, all those they will ask you. Why? What is the principle of this test? So here we have indole test, use Kovacs reagent. So what you do is, we take the bacteria from the colony, you have got Suppose this E. coli, the growth you have got from a urinary tract infection patient. Okay. So that colony you will take, okay, and you will put in a broth, liquid culture broth, and then we will be usually pectin water will incubate it. Okay, overnight incubation you put it. Next day you come and then you put this reagent, Kovacs reagent. It will produce a red color ring on the top if it is indole positive. If it is indole negative, it will show a yellow color. It will be same color, no change in the color. Okay. So this is usually positive for E. coli, Proteus vulgaris, Vibrio cholerae. So when you are having those colonies, you can understand. So you have done this indole positive. You are saying. So you know this may be the organisms. You know this is the how you are coming narrowing it down. So that is how we do it. Next is the citrate utilization test. Citrate utilization test is a blue color change. You can see here for Klebsiella pneumoniae and Cytobacter. Then we have urease test, which is positive, producing the pink color. Okay, positive for Protease and Klebsiella. Then for triple sugar iron, we have this. This is the H2S, which is producing the black color. Okay, see this I want to explain to you. Please try to understand. Okay. This is a little complicated, but this is asked in your exam. So what is it? Triple sugar iron test. Just by this test, we can differentiate or identify many bacteria. So, different properties of bacterium. See A. Can you see A? See this color, this part is called the slant. This is called the butt. Okay? The lower part is the butt. This is the slant. The slant is which color? It is pink color. And the butt is yellow color. Okay. So here you see some crackles or it has been pushed up because there is gas production here. The bacteria, we have inoculated the bacteria inside all of these tubes. Okay. The unknown bacteria. So this is producing yellow color here and there is also some gas production. Here you can see the blackening and this is pink. Here you can see there is pink color all over. There is nothing, no blackening. So we say the reaction is like this. See, Ka minus minus, Aa plus minus, Ka minus plus, Ka minus minus. Whoever is here should be able to understand because I will make you understand now this. Okay. So first of all, for example, A. This is, we represent K as K for alkaline, A for acid. And first negative is for gas, next negative is for H2S. Okay? This is made to make easy when you are doing your lab work. You cannot just keep on writing so much. Right? So this is the, internationally it is used. Okay? So what is happening here? This is alkaline slant, acid butt, Ka, no gas, no H2S. You get it? All of you? Excellent. So this one example they can ask you, Shigella. I want each one of you to answer it to your examiners, to your externals, if they ask this. We'll have these tubes, then you have to answer. Okay? Next is E. coli. E. coli is here. It is showing identification is what? Acid, acid. See, all through it is yellow, acid, acid, and there is gas. Yeah, you can say now, this is no H2S. Okay? Next is this tube. See, this is abundant, you said abundant H2S is produced. So this is alkaline slant, acid butt, and there is no gas, but plus is for H2S. Okay? Last one is what? For KK, alkaline slant, alkaline butt, and no gas, no H2S. This is for Pseudomonas. These examples also you have to know. E. coli, Salmonella. Okay? See, we have identified sitting in the lab, just up to this much if you can say this is a Salmonella. It's so beautiful, right? How the scientists have found all these things by doing so much of research. They have come to this conclusion. Okay? Next is the antimicrobial susceptibility test. Now, we have identified this is Salmonella. Take little bit of the colony and you put it in liquid culture media. This is a liquid peptone water broth. Okay, for it to multiply, and then you see for turbidity, that is particular turbidity that you have to see that it is come, and then what you do is you do a lawn culture. Lawn culture, I don't know this. In this, you have to take a culture plate and you have to make like a lawn. Means basic idea is with the swab, you have to cover the whole plate. The bacteria. Whole plate is covered, okay? And now what you do is, we get particular discs from the company. We usually use the high media disc. These are the antibiotic discs. These discs are made in such a way that they have got particular amount of antibiotics in this disc. Okay. So this disc you can see here, small discs. I'll try to show you in a lab. So these discs are impregnated with antibiotics, particular concentration. And then what you do is, after doing the lol culture, you put this disc at a particular distance. Okay. And then you keep this plate in the incubator. So the bacteria will grow inside the incubator. And then next day you come and you see what has happened with their plate. Okay. So what do you expect? We expect certain areas will be there. If the bacteria is inhibited, is not growing in this area, in this zone, means what? The bacteria is not getting, is been killed in this area. Understand? This is a clearing zone. The zone of clearing means the bacteria is getting inhibited around that zone, and this we call as sensitive. Again I'll repeat. Did you get it? So this disc we are putting here. Next day morning we are seeing, and we are seeing whether there is any zone of inhibition around the disc, antibiotic disc. If there is a zone of inhibition, then we know that the bacteria are killed in that area. That means what? This particular antibiotic is going to work in your patient, is going to kill that bacteria inside your patient's body, wherever sample you have taken. You get it? So that is how we look for. Now we have more, like this is resistant. Can you see? The zone is very small. Sometimes there is no zone also. Means this antibiotic is not going to help. It's not going to work. Then we have certain like intermediate also in between. Now what we do is, we have got this insert. There's a whole sheet of diameters, the zone diameters given along with your antibiotic discs. Okay, because there is some standardization of this diameter, the zones. The standardization is made in such a way that all over the world same standard is used for their particular discs. Okay. So now I take here ciprofloxacin. Can you see this? Ciprofloxacin zone, the disc strength is 5, and here zone diameter they are showing here sensitive, intermediate and resistant. So if the diameter is more than equal to 26 millimeters, it is sensitive. If it is between 22 to 25, it is intermediate, and if it is less than 21, it is resistant. So how to measure it? You take the diameter here, from here to here. You get it? And we have a scale. They provide a scale for this. So that's how we say this is sensitive, this is resistant, this is intermediate. And we, from the lab, we give this report to the doctors. So if you are sitting in the doctor's office, you will get a report. Now you have to decide which antibiotic to be given to which patient. Yes. Our class ekhano shesh hoyni to. Ekটু আসছে 5 minute. Okay. So this is what you got it, the whole story of till the antibiotic. Okay. Now we have got immunological methods based on bacterial antigen, surface antigen and agglutination methods, serological reaction, pathogenicity test in laboratory animals. So the main part is covered. Now something we have is called as automation in microbiology. So now what we are doing in this, what I have told all this time, this was a conventional method. Now things have changed, like physics has come in, to help our medical science. So we can also do it, everything to get it faster, this automation, the instruments. What are the instruments? You can get a whole question on this automation, okay? So these are rapid turnaround time, automated blood culture, those blood cultures which you are doing, even you can do it inside a blood culture machine. We call it the BD Bactec machine. You have to remember these names, okay? They'll not ask you much, only the principle and the name and the use you have to know. And the Vitec also. Vitec is the whole biochemical test what you are doing outside, that happens inside a machine. Okay? Just you have to grow the colonies, identify them, pick them, do the turbidity and put inside the machine. So this is a Vitec machine and this is a BD Bactec for blood culture. This is for ID and AST, for identification and antimicrobial susceptibility. Okay? This is Malditov. This is also for identification. This machine, what it does is, it finds out the ribosomal activity of the proteins, and that's how it identifies the bacteria. Even from the sample, from the body fluid directly also you can find it. So it is very faster and rapid. Malditov. Any good hospital or institute will have it. Then nucleic acid based identification. This is based on DNA and RNA sequencing extracted from the bacteria. This is also like polymerase PCR. Have you heard of PCR? PCR technology. So this is also very highly sensitive and specific. And the PCR is basically, the steps are DNA extraction from the organism. First of all, from the bacteria you have to find the DNA, and then amplification, they amplified the DNA, and then gel electrophoresis of the amplified DNA. So if you have little bit of the bacteria also, you can amplify it and find it out and give the result. This is used usually for mycobacterium infections, leptospira and chlamydia. Microbial typing is basically used for epidemiological purpose and also in the hospital, epidemiologist, hospital microbiologist, they'll try to find out a trace of, suppose there is an outbreak. They want to type it and find out which strain, whether it is hospital-acquired strain. So that is the typing is helping them. Okay. So determine the source and roots of infection, trace the cross-infection, differentiate between recurrence and infection with new strains, evaluate the effectiveness of the control measures. So outbreak investigation also, I think is done. So I expect you to go home, read the text today itself, because or else, there's some short-term memories. What has been taught here, you have to recapitulate,